Hello, my name is Danielle Chestnut, and I'll be talking about the use of restraints. The proper use of restraints was discussed in this PowerPoint poster, focusing on two different population types. The first were older adults in residential homes or hospitals, and the second was child and adolescents who were psychiatric inpatient patients. The usual patient outcomes for restraint use in the indicated populations was the patients ultimately ended up restraints without trying to use alternatives. So this leads us to talking about the practice guidelines, which state that patients who have high care dependency, impaired mobility, and impaired cognition were found to be strong predictors for people that would be put in restraints. The standards for fall prevention are strongly stated that any patients at risk for falls, this does not mean that they are a candidate for restraints. Just because a patient is at risk for falls, that does not qualify them for restraints. De-escalation techniques have become central to restraint reduction, specifically speaking in the psychiatric population, and education focused on restraint alternatives have become the guideline for ultimately deciding on a form of restraint. Then we move to speaking about the three different articles that I used. Use of physical restraints in a nursing home was basically saying that any patient who had a high care dependency was almost guaranteed to be put in restraints. This can range from a patient who was at risk for falls and a patient whose cognition was impaired. Now, what this article focused on was speaking to the patients, the nurses, and speaking to the family members and asking them if they knew why the patient was put in restraints, and if so, were there any alternatives that were used. Many of the nurses, patients, and family members stated that they did not know why the patient was put in restraints. Restraints in residential elder care facilities, this was basically stating the same thing. This also covered barriers that came with why it was hard to not put patients in restraints, and basically as a summary it was stating that because restraints have been used for patients who are at risk for falls and who have impaired cognition, that is what people think the standard is using restraints for that use, and that is not the case at all. And it was also having the staff not educated enough on alternatives to use for a patient who would possibly be a candidate for restraints. Restraints in psychiatric children and adolescents. This was saying that nurses were not proficient in creating a therapeutic environment for the patients. This also really focused on patients who are aggressive, which is an also high indicator for patients to be put in restraints. So what this article was focused on was teaching the nurses how to keep a therapeutic environment, how to engage in therapeutic communication, and also how to de-escalate a situation before it blew up to the patient being put in restraints. So nursing implications and how to warrant the change. So basically the changes for restraint criteria is changing. Restraints are not indicated for a lot of reasons. A few of those being that education is not only needed for the healthcare provider but also for the family and other people as well that are within the hospital. Evidence-based practice for the use of restraints focused on 4 top categories that I found within the 3 articles. The first one was fall prevention. If a patient is at risk for injury, this does not mean that they meet the criteria for restraint use. Fall prevention programs are also increasing and becoming a lot better as far as what they cover. De-escalation techniques, this basically means that a nurse needs to know how to de-escalate a situation before a patient becomes so aggressive that they do need to be put in restraints. Also the use of PRN medications without using them as a chemical restraint, and alternatives. What are the alternatives for any restraints needed to be, such as the de-escalation and the PRN medications. So basically overall, in summary, is that these articles were trying to state that they wanted to have alternatives used and implemented before the patient was put in restraints. Thank you.